So many of you have been asking what pelvic floor physical therapy is. Pelvic floor physical therapy is a specialty in the physical therapy world. We specialize in conditions with the pelvic floor muscles, so these are muscles inside the pelvis. So this might be urinary incontinence, fecal incontinence, pelvic pain, pain with inserting a tampon, pelvic organ prolapse, so where the muscles can become weak and the organs can start pushing out the vagina. It might feel like a used tampon is stuck in the vaginal canal. We treat conditions like constipation, IBS, diarrhea, prenatal and postpartum issues, low back pain, hip pain, SIA, tailbone pain, the list can go on and on. If you're ever questioning if pelvic floor physical therapy is for you, you can always send me an email at amanda@empoweryourpelvis.com. With pelvic floor physical therapy, what do we do? Our patients come in and we look at your medical history, so we're going to ask you a lot of detailed questions about bladder and bowel habits, any issues with menstrual cycles over the years, delivery of baby, was it a vaginal, cesarean, did you tear, did you have an episiotomy, how long was the labor, any issues like low back pain, hip pain with running or exercise, any leaking of urine or feces. The list goes on and on. Then we're going to look functionally at how you're moving, how you're squatting, standing on one leg, going upstairs, jumping, how you're performing certain exercises laying down on the table, and then we'll follow it up with an internal pelvic exam. So very similar to a gynecological visit, except there's no speculum, no stirrups. It's truly just assessing the muscle function of the pelvic floor muscles. So it's done just digitally with gloved finger, but inserting up to right at the first knuckle, right past it, and then a little bit further on past that. Usually 9 out of 10 women will say that that wasn't as bad as they anticipated, not near as bad, definitely not as painful as like a speculum or a well-woman visit would be for them. So if you ever have questions about any of that, please reach out. Having pelvic floor physical therapy is very helpful with improving your symptoms, especially for your future self. So we want to get you back where you're not peeing your pants with running, jumping, lifting the kids, because that might be a common symptom, but it's not normal, and let you get some help so you can get back to doing what you love.